Good morning, guys, or afternoon, guys. Um, Today's discussion A talks about homebound seniors living alone often slip through the health system's cracks, and it's by Judith Graham. Okay, here we go. Key issues faced by homebound seniors: unserved pop- unserved population. Around 2 million adults age 65 plus are completely or mostly homebound, with another 5.5 million needing significant help to leave home. These numbers far exceed nursing home residents but receive less attention. Health risks. Seniors like Carolyn Dickerson or Dickens face multiple health challenges: lung disease, high blood pressure, fainting spells, and hold on, I changed paper. Malnutrition. While living alone without support, isolation, and vulnerability. Living alone with serious health conditions creates uh, perilous situation, often leading to falls, weight loss, and emotional distress. Gaps in healthcare system, limited outreach. Despite the high number of homebound seniors, healthcare systems and policymakers often overlook them. Inadequate data. The statistics used are outdated, over a decade old, suggesting the problem may even more the problem may be even more widespread today. Lack of policy focus. Compared to nursing home residents, homebound seniors receive less attention from legislators and aging researchers. Example highlights: Mount Sinai's visiting doctor program. Dr. Peter Galietto uh, visit to Carolyn Dixon illustrates the importance of home-based care programs, which are rare but vital for this population. Would you like to explore models for improving care delivery to homebound seniors? Discuss policy frameworks that could address these gaps. Here are several successful care models for homebound seniors that have demonstrated improved outcomes and cost effectiveness. Okay, number one, home-based primary care, or HBPC. Source: John A. Hartford Foundation. Core features: interdisciplinary teams, physicians, nurses, social workers, Pharmacists visit patients at home. Care plans are tailored to individual needs and environments. Focus on what matters most to the patient, including comfort and autonomy. Outcomes. Just a minute, guys. Reduced emergency room visits and hospital admissions. Lower Medicare spending. Improve patient satisfaction and safety. Example, Independence at Home demonstration project by CMS showed significant cost savings and better health outcomes. 2. Integrated and multidisciplinary home health care. Source, MDP Umbrella Review. Categories of intervention: preventative and supportive home visits. Technological and digital tools, e.g., remote monitoring, physical, transitional, and emotional support. Benefits: enhanced functional ability, reduced hospital readmissions, increased caregiver and patient satisfaction. Challenges: digital exclusion, caregiver burden, scalability across diverse settings. 5 Ps framework for HPPC design. Source: Annals of Geriatric Medicine and Research. Framework components. Purpose: improve access and community of care. Continuity of care. Patients: medically isolated, frail older adults. People: interdisciplinary teams. Process: comprehensive patient-centered care. Patterns: longitudinal and adaptive services delivery. Policy implication: encourages debate on designing future-ready primary care systems for aging populations. Would you like to co-design a care model tailored to underserved seniors, perhaps integrating smart housing, therapeutic interventions, or culturally responsive caregiving training? Here are several successful case studies of care models for homebound seniors, showcasing innovative approaches and measurable outcomes. Mount Sinai's Visiting Doctors Program. Source: KFF Health News. Case: Carolyn Dixon's, a 76-year-old lung cancer survivor in Harlem, received care through Home visits by Dr. Peter Galeotto. Challenges addressed: severe lung disease, high blood pressure, fainting spells, and malnutrition, extreme isolation and lack of support. Impact: personalized medical attention in the home, prevention of emergency situations through proactive care. Great Plains Health Telehealth Transitional Care. Source: leading aging cases or case studies. Model: tailored ambulatory care platform with remote patient monitoring. Outcomes: 98% patient satisfaction, reduced hospital remission, improved medication, reconciliation, and self-care education. Self-help virtual senior center. Source: leading age case studies. Model: technology driven program to combat lonely or isolation among homebound seniors. Features: interactive online activities. Give me 1 second, folks. Social engagement and cognitive stimulation. Impact: enhanced quality of life, reduced loneliness and depression. For Banner Health Telehealth for super users. Source: leading age case studies. Population: seniors with 5+ chronic conditions. Tools used: barometric sensors, Philips Lifeline emergency response system. Outcomes: give me 1 second, guys. %27 reduction in cost of care, 45% reduction in hospitalizations, multidisciplinary care team coordination. 5 better care playbook case studies. Source: Better Care Playbook. Scope: peer-reviewed evaluations for homebound personal care programs across the U.S. Includes care teams or care team structures, payment models, and implementation strategies. Highlights: improved health and quality of life, reduced acute care used and costs. Scalable models for underserved populations. Would you like to explore how these models could be adapted for rural communities, culturally diverse populations, or integrated with smart housing and therapeutic interventions. Here's a breakdown of key differences between successful care models for homebound seniors based on structure, focus, technology, use, and outcomes. Comparison of homebound senior care models. Care model, primary focus, team structure, technology use, key outcomes, and crit, 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 critation. Critation. Okay. Mount Sinai's visiting doctors, in-person medical care for isolated seniors, physician-led, home-based, home visit-based, minimal uh, prevents emergencies and improves safety. Great Great Plains telehealth transitional care, post-discharge support and monitoring, ambulatory care team, remote patient monitoring, high satisfaction, reduced readmissions, self-help, virtual senior centers, social engagement and cognitive stimulation, programs, facilitators, and tech staff, highlight or high interactive online tools, reduced loneliness, improved quality of life. Banner Health Telehealth for super users. Chronic condition management into multidisciplinary team. Biometric sensors. Emergency alerts. Lower cost, fewer hospitalizations. Better care playbook and HBPC models. Scalable home-based primary care varies by program, varies improved health, reduced acute care use. Key different differentiators. Care delivery model. Mount Sinai traditional in-person physician visits. Banner Health and Great Plains tech-enabled remote monitoring and telehealth. Self-help virtual senior care centers. Virtual engagement not critical care. Target population. All right. Banner Health seniors with multiple chronic conditions. Self-help VSC, socially isolated but cognitively capable seniors. Mount Sinai is medically fragile and socially isolated individuals. Technology integration. High Banner Health Self-help VSC. Moderate Great Plains low Mount Sinai scope of services, comprehensive medical Mount Sinai Banner Health, transitional and preventative, Great Plains social and cognitive self-help virtual senior center. Would you like to explore how these models could be hybrided? For example, combining telehealth with memory-friendly housing or integrating culturally responsive caregiver training. Absolutely. Here are real-world examples of successful implementation of care models for homebound seniors, each demonstrating measurable impact and innovative strategies. Mount Sinai's visiting doctors program, New York City. Challenges addressed: senior severe lung disease, fainting spells, malnutrition, and isolation. Impact: personalized care prevented emergency hospitalizations, built trust and community in high risk underserved population. Okay, significant reduction in hospital readmissions, improved medication uh, reconciliation, and self-education. Okay, guys, so that is A for you today. I'll be back on tomorrow for shows. For now, Gator Wellness. Take care, folks.